a horse that was quite violent and aggressive. They were going to send him to a slaughterhouse. He got adjusted. He's a completely different horse now. So I guess all mammals, you can literally adjust any vertebrate animal.
There's this doctor also did it on the snake.
I think I saw one about with an iguana, a green lizard, an iguana.
Hi everyone, welcome to Puzzle Exchange. I'm your host, Dr. Deb. I'm a TCM doctor with 17 years of experience. We meet different practitioners and discuss different healing methods. Today I'm talking to Dr. Cory Shank. He's a chiropractor who's doing things differently. We're exploring how chiropractic care has evolved beyond just cracking backs, and there's so much more into it, including gentle adjustments and soft tissue work. And we're going to be talking about working with babies. We also do infant massage and how both chiropractic and acupuncture can help with animals and the energetic side of healing like Reiki or emotional release. And we will also dive into prenatal and postnatal care, how chiropractic and yoga can support moms through their pregnancy and recovery. And my favorite part is we'll try treatments on each other and we'll see the real results. Let's go. With the chiropractic techniques been involved, do you know, is there a difference? Like traditionally what people think of chiropractors do and then what you do now is combining with these two together?
It's a valid question of how any modality changes and morphs through the years. What chiropractic was first devised as from the founders of D.D. and B.J. Palmer. And as they were going, they had their different techniques. And I'm on the side of a non-traditionalist, and mostly because that's how I first came into chiropractic, was a gentleman who was doing soft tissue work, BGI, which is biogeometric integration. That's a technique, and typical diversified chiropractic adjustment. And diversified is, I guess, the osseous making a sound when you make the adjustment. And I think that's the public's main view of what chiropractic is. And my view is just like better in terms of the more the techniques, the better the profession, because it can then call towards a greater public service and more people can then ascribe to what works for them. The frustrating part of that is it adds confusion and it's hard to market and communicate that to the people. And so I think it can totally be possible. And to your question, I think it's great. And it shows that it's not a stagnant profession. It's like forever evolving profession. And when I first went to school, I didn't realize how many techniques was in chiropractic in that profession. And it has as many techniques as soft tissue massage world. And again, I think it's wonderful because it can call to a lot of people. And I think it strengthens the profession at large.
And for what you've learned and what you do right now, what's the most kind of cases you take in, or what do you like to work more into?
Yeah, it's kind of like you, where I don't know if I have a specific demographic that I lean into. I definitely don't market a niche or a niche demographic. There's a saying that pain brings them into the door, but joy keeps them there. So it's like somehow people find me through word of mouth, and hopefully I can give them something in order for them to stick around or stay underneath care, because it is a preventative profession. It's alternative medicine. And so I am looking to serve more babies and infants and prenatal care and postnatal care. It's another part of the population that I don't have a lot of experience with, but I see the value in it, huge value of being able to help babies when they're young, because they're so much available to help them in any situation in terms of a lot of jaw and neck stuff coming out of the breathing canal. So there's a huge value in helping babies come into the world with certain misalignments.
How young could you treat?
It's a valid question. There's even a couple days old. If you have heard some chiropractors be there at the time of birth with the midwives and doulas, and there are chiropractors that do alcohols like that. And so it's just so that sometimes they can latch good onto the breast. And sometimes TMJ and the tongue tie and how the palate is, sometimes newborns don't come in with that all functioning.
I never thought of latching on could be also something that chiropractors could do with a little bit of adjustment that will help with the latch-ons.
These adjustments, we're just talking touches, though. Yes, if you were to touch your eyeball, it's just very light touches, but that's enough to make a shift in the tissues, and that shift is what we can call, air quotes, adjustment. So that's like, we want to be clear on the verbiage. You know? So it's not a strong or quick. It's just like gentle touches, and we're just nudging, especially with like internal mouth work. You're just guiding the palate to raise, or you're guiding the vertebrae just to like rotate a little bit, or sometimes the neck can get tweaked coming out, and so then they have torticollis, which is like a skewed neck, and so you just want to be able to get the cranium back on top of the vertebrae.
Because I do have also a couple babies that come in with carditis, and that I do with needles and with some massages as well, because I don't really know how to adjust those. but with the needle, with the cheek acupuncture, I just need to use the shortest needle, just a few pokes, and it immediately relaxed the muscles. And I had one that was 8 months old. And before he came to me, he was going to physical therapist in London. He was doing pretty well in London, but after they moved back to Beijing for 2 months without the practicing and all that, it went back again. So that's why they came to me, and with the treatment, we did probably 4 treatments, and it was really loosen up, and they will be able to go back to UK again.
Mhm.
Yeah.
Awesome. Do you serve babies with any digestive issues?
Yes, mostly with babies, they're all either bloating or constipation. In TCM, we have for infants, there's a different type of massage. I don't know if you've heard of the child's massage, and they have a different set of points, not like the acupoints, but this finger represents the lung, this finger represents the liver, and this is with the spleen and stomach, and then this is the heart and kidney. So for babies that are fussy at night, that can't sleep, or they're having a cold or something, we'll do just to block the heart, and then just to do just like this kind of gentle touch for a minute or so, and that's already 100 strokes, and that will be able to calm down the baby. And we can do some circles on the palm, and that's for helping the digestion energy. Yeah, so there's a lot of people take their babies to TCM doctors, and they do this. And also there's another one is pulling the skin alongside the spine, and that's more for helping for immunity and help them to grow better, and also to calm them down when they sleep.
Awesome.
Yeah.
That's the bladder channel at the spine, right?
Yes, and we call it, which is just pinching the spine. Yeah.
Awesome.
I've also seen for pets, there's chiropractors for pets. Do they teach that at school, or that's only for veterinarians?
Yeah, it's not in the curriculum. We did have the school that I went to over in Hayward. Had a lot of clubs, which is unique to that school, and that's a big draw to it. And so there was definitely a pet chiropractic club, and people would bring their pets and practice on them and do that. And if people want to learn that, it's those seminars out extracurricular and on their own time. I haven't learned any of it. I do like to palpate and touch the spine and just get a sense of what's going on with dogs, mostly dogs, a few cats. But I don't do that. Some of my colleagues adjust horses, and it's quite cool too. I know it's just awesome. I went over recently to a stable over in Marin and was watching a colleague do it. And she had been doing it for about 8 years. And that's the reason why she went into chiropractic, actually, is she was a horse rider before. And once she realized that she could adjust horses, she was all in. And so knowing that after school, that's the direction she took. She sees some people, but mostly it's horses. She goes around to these different stables, which is really cool.
With the size of the horse, how do they?
I know. She's not big in herself. She's just a normal
Do
lady.
you need something to stable the horse, or you just go and hug the horse and then?
No, it's a great question. So I've only seen it a couple times, but they simply put ropes onto their holster, and the horses can roam back and forth. But they have a big old black box that's out of wood. Is just something easily to move around, and the doctor was up there just doing these little thrusts, but it's enough to. Sometimes you don't make a sound, but there's these thrusts and these contacts for these horses to make a difference. And one horse, particularly before and after, and they do these little signs that the horse chiropractor knows what to look for, these muscle twitches, and then how they move their head if they're either disassociating or staying with the session. It was quite remarkable. But afterwards, seeing this horse walk away, it was as if he was sleepwalking, and they're like jokingly drunk. But it was really significant about how the horse responds. And there's this nice movie documentary called Adjusted about a horse that was quite, let's just say, violent and aggressive and would fight and bite and kick. And they were going to send him to a slaughterhouse or whatever. And he got adjusted and was underneath chiropractic care. And he's a completely different horse now. So I guess all mammals, you can literally adjust any vertebrate animal and have some benefits from it.
Because I did not only mammal, I did see people. There's this doctor also did it on the snake or something because they're so long.
Yeah, vertebrates. I think I saw one about with an iguana, a green lizard, an iguana. Well, it's quite impressive too.
Cool.
I don't think I'll ever go into animal chiropractic in terms of something to charge for, but for friends and family, I'll look out, put hands on. But we'll see, that may change. But
then how about with elders? They're more stiff, and then you also work on the soft tissue, then do a little light adjustments, or?
I actually, in Marin, my office is across the street from assisted living care center. And so I have, and I go over there on Tuesdays now, and I recently see 93-year-old beautiful lady, and I think she's 88, 89, wonderful lady. They're awesome. So there's still plenty to do, even with osteoporotic, arthritic skeletons. And most of that because of the NET or the BGI. There's another technique called SOT, sacral occipital technique, where they use these blocks. And you can still do a lot with not like they call it a high velocity, low amplitude adjustment, where it's like that quick thrust kind of thing, trying to gap the joint space. In some of those bodies, that's totally not appropriate, but you can still do these other chiropractic techniques that give them benefit. You can align the pelvis, and then the whole activator, spring-loaded instrument SLI adjustments is very appropriate for those bodies. And it's those techniques, as well as the soft tissue, is how I approach those type of bodies. I think a lot of joints like knees and elbows and shoulders are very responsive to that kind of technique. And certain things, it's just minor changes that you can do after a while here and there at the age of 80s and 90s. So you just try to slow the process down of the degeneration and everything.
True.
I find for the acupuncture, I'm sure it's all bodies. It's mostly about like the skin and the blood vessel kind of stuff. Is that true? What you have to look out for?
You mean by not to poke into the blood vessel?
How does your care change for the elder population?
Well, pretty much the same. Also, because with needles, it's much gentle, so it's not like bone adjusting or anything, but also working with some massages first just to help them to, one is me to feel where the tensions are, and then another just with some gentle touch and all that, they feel much better already. And with acupuncture, now that I use cheek acupuncture, I don't need to put it in the bodies, and also you don't need to expose any skin. So it's easier for me to just use that. And with elders, a lot of them have neuropathy. Some have like side effects after a stroke. So with after stroke, there's some numbness or some lack of motions, and that then we use acupuncture that could help with if they have numbness in the fingers and they have more range of motions and all that. So that's usually for a lot of elders. Scientists have been trying to prove that it's because of nerves, but it's not explainable by just using nerves.
Yeah, the energetic system of the body is separate than any of the physical, even though it lies within the physical. And that's part of the confusion and the maddening part of it. And the skeptics can easily point that out, but at the same time, so many results with it. And that's the beauty of this complex system that we have, is that energetic system that's enmeshed inside the physicality that we really can't put a finger on it. And this is how in the world, and there's the TCM and the other modalities that have definitely detailed it out and mapped it out through painstakingly mistakes and all through the generations. It's quite remarkable. At the same time, it's very humbling to know that how can we actually pin it down and prove it? Because it's just really hard. And that's where even a lot of professions get into peer-reviewed studies. Is in order for the scientific mind and the skeptic mind to be believing in it, it's like if you see it or read about it, then they believe it. But it's a shortcoming, and unfortunately, it can't have enough peer-reviewed studies to actually prove it. And that's kind of the nature of what we're in.
It's still not like you can't really prove where it is. They have a lot of needles going down and then seeing how the anatomy is. This is close to which nerve, and that's why it relates to which area. But some is not even close to any part of the nerve, but it still works there. They're still working on that.
Also work with energy?
I do. If we were talking technique, is like a good old Reiki energetic system is a modality that has been taught, and it's just a universal healing energy that everybody can tap into. And I think that a lot that once you talk about energy, it's prana, chi, breath, right? It's very linked to all of that. And so in short, the answer is yes. And then the more complicated response would be how and when and why. At that point, I think that's where it goes into the art of the practitioner and the session, is that hopefully that person can then rely on their intuition and the background and the strengths that they come in with to then work intuitively and energetically about how to use that in the session. So I think as well as with you, is either hands-on energetic communication or hands-off, right? Because we know that the body doesn't stop at the physical level, but there's these koshas and these layers off the body that we can tap into. And so there's off-body Reiki holdings and just transmuting energy.
So you used to also use Reiki. So do you have patients that have emotion, some of the pain that it's emotional connections and that, then will you use a different method for these type of patients?
It's a great question. I don't really use different techniques. It's still going to be about holding a healing container And if emotion does come up within the Reiki tradition, there's ways to work with emotion. And so then that, and as we know, emotion needs to roll through, and they either do it verbally with breath and sound or movement, or they hopefully can integrate it or dissipate it inside too. And it really is individualized on how that is seen and done. But as the practitioner and as the holder of space, it's really dependent on how to do that. And I think that's in the moment of how to do that. And it's always different for sure. I try to do less verbal processing just so that, again, I'm there to work mostly on the physical body. And that then it can be a tricky category to psychological processing, which is not my education or background. And there are times where people are verbalizing. And mostly I just want to hold a neutral space for them to process and heal and dissipate and integrate as much as they need to.
That's like, you need to find the balance with the patient. And
yeah. How do you find moments with emotional release? How do you...
So it depends. Some patient really connects with you, and then it's easier to help them to release their emotions, like the blockage and their pain. And some, if they're skeptical and they don't really trust you, then sometimes it's hard to work with. So then if those kind of condition, then I'll use more, either using herbs or just using needles, just to let them calm down a bit. Or with the herbs, have them to take the herbs for a week. And some of the herbs I'll use more is depends. Probably most are related to the liver energy. When the liver energy is stuck, then it affects your mood. So then with that, after a week, they feel like, I feel much relaxed this week. And then probably they'll tell you more about what's going on. And then you can slowly work into that. So it really depends. And sometimes if they don't trust you, they won't come back, and that's it. It's hard sometimes. Yeah.
Do you do care plans? Do you, if you have somebody come in and you trajectory, do you offer care plans? Do you have a way where you would like to see people on a weekly, monthly basis?
Usually the best is, if it's a much acute condition, I would love them to come in twice a week, but everybody's busy right now. At least I'll let them come in once a week. And for a quarter of time, it depends on the condition. Sometimes after 3-4 sessions, then they can come in twice a week, or sometimes if they're all good, then probably use some herbs just to sustain the whole process, and they can come back once a month and just to check in and see if it's all good. Yeah. So it really depends. And if it's a pain condition, some could come this month, and then another month they're all good, and then they'll have something new coming up and they'll come again. And your sessions are once a week?
Very similar to yours, that if it's acute, I would suggest them to come in later that week. Not a lot, but mostly the following week. Mm-hmm. And then other than that, it's just I call it easy street, really hands off, really easy. I don't lean in too much to care plans, but I tell people at least once a month, go somewhere. And I always say, you don't even have to come back here. If you like acupuncture, if you like hypnotherapy or massage, keep something on the regular just because of life. So sometimes they come back, sometimes they don't. And I just find it to be really, I'm not attached to it. I'm really not needy and really trying to grab their business or their attention. So it's really hands off in that way.
And also, I'll tell them some of the home remedies and what they can do. And some, they just text me, now I have this, what should I do? And then just tell them, I'll just drink some kind of herbs that it's much accessible to get. You don't really need to come to me. Or if it's just a cold or something, in China, it's easier to get some over-counter herbs, so they can just get it online. The herbs will be there in 30 minutes. So sometimes just home remedies, and they're happy, and I'm okay.
Do you find that there are some herbs here that you can't get that you can get in China?
Actually, I think most of the herbs you can get even with the over-counter herbs, it's easy to get in Chinatown. I haven't really looked really deep into it, but the most common ones that I use the most, I think with Chinatown is enough. Or there are little companies in the States, they carry a powder type, or you don't need to really cook the herbs. And those are more, or some capsules. So in the States, I think it's quite accessible. Have you tried any herbs before?
I have. What is this, 25? I guess in 23, I have a couple of friends that are acupuncturists, and she got me on some formula. I forget exactly what it was, a couple of them. And it was pill form. And I've had some tea formulas throughout the years, but it would be just a short-term application for myself, maybe 3 months at the max.
But 3 months is already a long time.
Oh, is it?
If you can, even for me, I hate taking herbs. Sometimes I can't even last for a week. So if you can really go through the whole 3 months, that's really good.
Well, maybe there was a while ago for that tea with loose herbs, and loose tea. This last one was just like a pill form and just buying in capsules. And so that was maybe a 3 or 4 bottle experience. I think that's what my situation was like. I'd feel the effects in the beginning, and then afterwards it would less taper off because I would feel the effect, or then I would make excuses about money or something, and then I would stop taking them.
Actually, with herbs, because your body changes, so at first you feel the difference, but then you need to change the formula again.
Makes sense.
So at least a month or 2 months top, then you need to go back to check it out, check what your body type is right now. And then we might need to change the formula because since your body has changed, then these herbs are not what you need anymore. It's probably you're already balanced. That's why you don't feel anything. And if it's more of for boosting the energy or those types of herbal medicine, you can take probably a month or 2 months and then just stop and then just have your body run by itself because your body knows what it should be like at balance. As long as you don't really go damage it or do something crazy, then it should be fine. And if you fall back to like you still feel tired and weak or something, then you can go back to the original formula for a couple weeks and see if that get you back to where it is and then rest. So I don't personally recommend people taking herbs for such a long period of time unless they're cancer or really chronic conditions. Other than that, if you're a normal person, your body should know what it is like to be balanced and how it can heal itself. So I'm more towards that kind.
Makes sense.
Nobody likes to take herbs that long.
I remember some of these concoctions were not helpable. They were not fun to take down.
I could say 90% of the herbs don't taste good.
They do the job though, don't they?
Yeah, no. Even for the kids that I treat, I always tell them, I promise you, I'll try my best to prescribe something that either tastes like some kind of juice or at least tastes nice. And some kids are really good. I have kids that are around 3-4 years old and they've been taking herbs since they were babies, so they're quite okay. And I remember there's a brother and sister, their mom will take them to me once in a while. Every month or 2 or so, they'll come back and say, okay, now he has this and that, and I'll just prescribe a week or 2. But because of the dosage, they only need 100 milliliter for the whole day. They don't need to take as much as adults. So I prescribe, for example, I prescribe for 3 days of herbs and they can have the whole week. That's about a week of amount they need. And that's going to last for a long time and they don't need to come back to see me again. And every time I see them, they're pretty happy because the herbs that I prescribe are tasty. Some are with orange pills or with dates or with licorice or a little bit sourness. And I always tell them the mom can give them some candy or add a little bit sugar in the herbs so it doesn't taste that bad. What you're going to learn or study into other or stuff like that?
Yeah, pretty much less on modalities, but mostly I do want to lean more into the babies, the pre and postnatal care in babies. That's what I'm leaning into.
How do you do prenatal care? Or for the mom? Or
Exactly. For a successful vaginal birth, we really want the pelvic to be aligned. And it's been, I'm sure there's some studies out there. I don't want to misspeak, but Webster technique is designed for that, is to make sure that the mama's low back and pelvis is aligned so that the baby can pass through easier. So it's really big, and there's mostly we want delivery time to be as less amount of time as possible, is really short.
So one more question. What do you think about prenatal yoga?
I think I'm biased towards yoga. I think it's a wonderful tradition. And I think then it's more of a particulars of the individual for keeping the legs both open and strong, as well as the legs and the pelvic to be open and strong. And if they like the yoga, then do the yoga. If they like the whatever it is, movement, it's mostly about making sure that the mama is moving and having a healthy legs and pelvis.
And how about the core energy and all that?
Yeah,
or
I think
it's more with the pelvic.
I think because they're just carrying so much weight, I think the pelvic strength and core is already being activated just by moving around. And I think it's mostly about how to work with the compensations of how to hold the extra weight that's happening. And so there's always, I think, in my opinion, a combination of stretching some parts, strengthening some parts, and softening some parts. And some yoga poses are really good for that, and others you need some from the outside. But in general, I'm a fan of prenatal yoga and any type of movement that the mom likes, just so that they keep the legs underneath them and a strong back.
Cool. And you do any adjustments for postnatal afterwards if they have incontinence or their pelvic floor is too weak and they have lots of pain while they walk after giving birth, how soon can they do any adjustments?
Yeah, as soon as possible. And again, adjustment is held loosely. It doesn't have to be on the bone layer. Soft tissue shift can be an adjustment. And I don't do any pelvic floor work with females, but definitely we want to be able to make sure that the pelvic is aligned, the sacrum and the ilium are communicating well. The pubic symphysis often gets misaligned through pregnancy. So that's another point of area that we need to check. And then the low back. And so I will concentrate on all those areas. And that's really important postnatal for sure. It's mostly about, and then the being able to support the core, because this has been spread so much. It's being able to keep that closed in through, that's when the core work obviously needs to be reintroduced. But
do you have lots of moms come to see you, or?
I do, not so much immediately after birth. One lady did come in within a month after her birth, a couple of them, but usually they're pretty good. Surprisingly, they didn't have much of vaginal tears or anything. Like they handled it well, which is great. And after that point, you just want to settle them in into being able to be active and caring for their new baby. And so that's the ideal, is that they are able to, and again, biasly speaking, is like pelvic was aligned so that the baby can pass through easier on the mama, easier on the baby. And then the post care is you just like get them going into their activities and into their life much more quicker.
That's really nice, because I feel like, I think in China, they're really hot in doing prenatal yoga and stuff, but a lot of they still carry the traditional way, not to do anything before giving birth and then lie the whole month after birth. But we see with that kind of moms, they're much weaker because they're not that active. And so, like you said, with your patients, they're pretty good. I believe so. What I see in China, most of them have lots of pain and they don't know the breathe work during giving birth. And the first week after birth is painfulest time for them.
A couple points on that is like, I can't imagine what the birthing process is like, but it's a bit of a marathon in some cases, hours long. And so we want the body to be able to get toned enough for that to happen. And that usually is done through our program, whatever that is. So that's one point, is definitely subscribe to the mamas to be active before birth for sure. And then going back, mostly the mamas afterwards is breastfeeding. And so it's a lot of upper back tension. And so that is mostly what they're coming in for. Is like usually if they've done enough care before the birthing process, the lower body is pretty well. But then now that they are spending hours down in this position, it's the shoulders, upper back.
Then there's a lot of that. Cool. Well,
thank you so much. It's been great.
I really enjoyed the talk with you, and thanks for the treatment as well.
Yeah, you're welcome.
Yeah, I learned a lot.
Likewise, I feel great. I really appreciate it. You can find me at my website. It's coryshank.com, CORYSHANK.com.
Cory and I did a cross treatment. I helped Cory's leg pain using FSN treatment. So FSN in Chinese, we call it 浮针, meaning the floating needle, because we don't insert the needle into the muscle tissues. We just put it underneath the skin. We can relax the myofascia, relax the muscles, and helping the blood circulation to get back and decompress the nerves. You don't just lie there. I'll need you to interact with me. You might need to do some movements with me. I need to do some pushing, and you need to push. We'll do some manipulating on the muscles, and I need to do the swing on the needles.
It was a pleasant, quick response with the needles. No pain, and an immediate response to it very quickly, which is results are always really fun to get really quickly.
Cory helped me fix my hip impingement. It's much relaxing because I think with Cory's, you do some with the soft tissue combining with a little bit of adjustment. And it's more, you can feel the difference than other chiropractors. You just do some cracking and then that's gone. But I love your touch with finding where the tensions are and relaxing the muscles a bit more, then do the adjustments. I think that will help to prolong the results. With the cracking, it's not that scary because some are really scary, I feel. And now I do feel like much lighter.